We have Josh Cameron, who is the Chief Strategy Officer at workforce.com. And then along with Murphy Daly, who is an industry veteran, to talk about the healthcare industry and how it will be disrupted by Amazon.
Thank you, Meg.
Yes, so I'll hand it off to you guys to go ahead and get started.
Cool. I think before we get started, Murphy, you just want to tell us a little bit more of some of the work you've been doing in technology and in healthcare. Just give us a 30-second rundown of some of the things.
Thank you. Yes, thank you. I actually worked for Kaiser for 9 years, and more recently I've been involved in some COVID support, testing and vaccine delivery. And I am very excited about the telehealth opportunities. In particular, my specialty has been audio video conferencing, which has been popular lately.
Certainly the right place at the right time, I think.
Well, it was waiting to be used in the crisis.
Yeah. No, excellent. So this is going to be fairly informal today. We're just going to run through a few of the things we're seeing about how we think healthcare could be disrupted by some of these big tech players. So it's going to be interesting, and feel free. It's great that we've had some people chiming in already. I see Charlotte has mentioned that Amazon's opening new distribution warehouses in South Dakota there. So I think that's happening all over the country, and I think it's just something. At the end, we're going to sort of talk about what are some of the differentiators that traditional health providers have, and how we can make sure we're really taking advantage of those. So let's get started quickly. And again, if you have anything to share, definitely put it in the chat. These are much more fun for us when we have more involvement from everyone. We get to sort of see what's happening out there. So
we love your chats.
Yes, we love your chats. Cool. So I know we have some people who are sort of in the nursing home aged care sector, but we're seeing, I think, the easiest starting point for some of these larger corporations and tech companies getting into healthcare is certainly on the pharmacy side and on the sort of more retail parts of healthcare. We've got some good examples here. I know that we saw Walgreens get into a lot of the testing and a lot of the vaccinations. So we think they're sort of in one of the best places for expanding into offering more and more services that just have that huge physical footprint across the whole country. So I think we see more of that happening, similar with Walmart for care clinics in store.
It's such an easy thing to go to the place that you already go to regularly, to have it be also a place that you can go to get healthcare.
Yeah, it does make a lot of sense. This is a bit of a graph. This is in US millions. You can see that things have really been expanding. In 2014, it was a fairly small industry, but the growth has been really quite impressive, and we don't really see that slowing down. You can see the projection through to 2025. It's just for this to keep on growing and growing and growing.
I actually saw that my time in Target. I think I started around that 2015, 2016 at Target in retail management, and wrapped up around like halfway through 2018. And all of our Targets, especially during remodels, they were adding in those CVS healthcare clinics and the pharmacy option. Because before that, not very few stores even had them. And now almost every Target has one.
Okay, that's a really good example. I see we've been chucking some polls up. Let's just have a quick look at what people have been saying here. So 56% of people are saying that. What have they been saying? Does anyone understand how to see the yes and no in this part? I think I've left that off the first one. Maybe I just don't know how to read a poll, but I can read the second one. So but a lot of people are seeing these. Have you come across or used any of these retail healthcare systems in the past? Most people are seeing them, so it's pretty hard to miss, I think. In most areas, we've seen the footprint get out there. And we've also had some more chats come through. We'll come back to those later. But yeah, we can definitely see this. It's been growing year on year. The amount of retail clinics operating is really expanding across all parts of healthcare. Yeah, so I think COVID was really a bit of a tipping point for this e-health, telehealth. What, Murphy, this is probably right down your alley. What have you seen in terms of the expansion of this? And I know for me personally, every time I wanted to go to the doctor, it was kind of like I was getting diverted into this, these e-health, telehealth programs.
Well, because they were trying to avoid people going to a potential infection vector. Everyone goes to the hospital to get care. Hospitals and doctors' offices have always been a place that sick people gather. So it's a problem if you don't want people to catch what everybody else has, don't go there. And in COVID, everyone was extremely aware of this. So the problem with diverting into a telehealth or other than doctor's office care environment was you couldn't get paid. You couldn't get reimbursed by the major payer, the
insurance companies. Yes, exactly.
Well, not just the insurance companies, by the Medicare and Medicaid that were federal, the CMC. So I think that's the right acronym. And so when COVID happened, it was released. They're like, okay, you can get healthcare remotely. You can get telehealth, and that is why the use of this technology has increased so much. It wasn't that the technology wasn't capable of it. The technology has been around for a very long time. I mean, we've got FaceTime, but to be able to truly set up a system where doctors could ask. Not everything works for telehealth, but a lot of things do. A lot of things are perfect for that. And so this was a way that healthcare providers could actually distribute healthcare to people that needed it, and people were finally comfortable with it. So it's profitable, it's something people feel okay about, and so it's a good starting point.
I think what we're seeing, I think the risk here for traditional providers is once you have something that is technology based, we know it's more scalable. We know that people will it will become more of a winner takes all market, and we'll see maybe a small number of players take more of market share there. Do you think that could happen, or do you think that's what we'll see over time? Or
no, actually, I don't think so. The things that are physical space and systems that address physical space are something that is useful in a market. Like Amazon's specialty is they're really good at shipping stuff. They could be a really great pharmacy. We can rely on Amazon to get us our stuff. And so medicines delivered to your house, that could be great. I don't know that Amazon in particular would be good at setting up doctor's appointments, because that's making people match with other people and scheduling it. The technology that makes, like what we're doing right now, makes that possible. There are a lot of really great platforms out there. And there are more coming up all the time. And so if the underlying platform allows for responsiveness and certain specialties that are needed by, goodness, if all of you healthcare providers that are on this call know, there are 1,000, 1,000,000, it seems like, specialties of delivering care. And so if it can be specific to that care delivery model, then that platform might win.
Yeah,
so I know consolidate.
We've seen out of Chicago, like sort of counseling software, but for very specific sort of mental health patients, like that it's just customized to what they needed from it, and that they've been very successful. I know that.
Yeah.
So I think that could be. I think the other thing that's interesting is when we see more of a hybrid model. So you still might want to see your doctor sometimes in person for some sort of things, and I think that's certainly one way that traditional providers can continue to be competitive with the big corporations moving into this area.
That's the other thing too. Hey, has anyone on this call been somebody that's enjoyed being able to work from home and not having to drive far to get to their office? Well, doctors might feel the same way too. So they might want to have physicians who have highly sought after skills might be like, I'd like to have 2 days a week where I work from home. So that is beneficial to the physicians.
Yes.
And then days when they go into the office, and that makes their work-life balance better. And might keep them in the workforce longer, because doctor, I need you to take care of me. You know stuff I don't know. I can't heal myself.
My roommate, her retired father is a doctor, and with COVID, he came back into the workforce because he could work from home, he can work from wherever, and he just does telehealth. We were actually talking about this last night, so I was like, but that's really cool because it brought someone back into the workforce after he was retired, because now it's just so much more convenient for him.
Yeah,
and I think in more of a skilled nursing context, we just know there's such a shortage. It's so hard to find skilled nurses in a lot of these environments. So maybe the more telehealth that we can do, and the more we can do that way, the easier it is to keep these people in the workforce longer. The easier it is to give them that work-life balance you're talking about, and that so many people are enjoying now by being able to work from home at least a couple of days a week. So I think that's really interesting.
Right. One of the other things too is quite a while ago in 2014, I helped set up a telehealth care inside an emergency room. So the emergency room, somebody came in and they had a stroke, and maybe it was a stroke, maybe not, but they had to go through the tests that were available in the hospital that they came to at the emergency room. But the person who needed to address their specific situation was in a different hospital, I don't know, maybe in the same state, but like 100 miles away. And that interfaced with a specialty nurse, and the doctor with the knowledge helped them in combination with the two, help them get a type of medicine that would help a stroke victim. I'm sorry, I don't know. Some of you doctor people on the call would know this, but I don't know this. It was a very specific care pharmaceutical that, if it was given in a specific amount of time and they had specific things that had to be in place for it to be the proper treatment, they were able to get that person that medicine within a half an hour of arriving at the ER, because that specialty doctor was available through telehealth and worked with a local ER nurse.
Oh, wow.
Another way that this happens too.
Definitely for regional areas, isn't it? Like where the specialties just aren't even available close by.
Well, it has to do with having that specialist be available at all times at multiple ERs, but doesn't have to be in the hospital, the specific hospital that is local to the ER.
Yeah.
And so when we're talking about specialty, the resource of that special doctor being a choke point, then we can deliver the care to the needed patient.
I see Carl has been chiming in, saying that in his organization, their telehealth utilization is 7%, with overall behavioral health at 20+%. I'm taking that to mean it's under half of the potential telehealth sort of appointments are being done by that.
Carl, what state are you in? Is Pisos listening? Wyoming. Oh, Wyoming. Wyoming is a bit has a lot of spread outness, I should say. There's not a lot of population density. Interesting. I don't know what to think about that. Do you wish that there was a greater adoption of telehealth, or what do you feel would be needed to help, Carl? What do you think would be needed to help your patient population feel comfortable with it? Social distance naturally. There you go. Yeah, I got to tell you, I was born and raised in Alaska, so I get the distance stuff. They're like, no thanks, I'll just be over here. Yeah, we'll see what happens. Most doctors. Oh, maybe it's the doctors that feel weird about it. I don't know. Our subcontractors. Oh, yeah. Okay. Oh, Deborah, most doctors are subcontracted to facilities as opposed to private practice. Okay. Yeah, telecom, if it can be implemented right, if it can be introduced to the patient population in a way that they feel comfortable with, then it's a really beneficial thing. But we have to remember, as it's being put out there, this is to help the patients. It's not. It's the healthcare is meant for people who need healthcare, not just the technology that it fits. So sometimes as an IT person, I can be, oh, look, you could do this and you could do this. Like, yeah, but that doesn't fit people. It has to fit the people to be successfully implemented.
Yes.
Effective. Thank you guys for all this for this communication. It's fun to have this conversation.
Definitely.
I don't see the questions. Oh.
Oh, really? Sorry about that, Denise. I really thought you would be able to.
So in this above the chat, there is a poll. I don't know if you're seeing it the same way, but there's
Andrew will reach out to you, Denise, and okay. I think you should be able to see the questions. But we will read them out from now on, and we will keep moving through actually because we already used up
that, Denise.
So I think some of that's what we were talking about here. We've sort of already discussed. We saw a huge increase in telehealth in 2019 to 2020. I think that's going to keep growing as we've mentioned. People are getting more comfortable with it, and as Carl mentioned there's the larger the provider caseload, the more cost-effective telehealth is, and the more it's using. Doxy, I'm actually familiar with. Yes, I tend to agree with some of the things in Doxy. It's Carl saying that Doxy.me, the telehealth function, leaves a lot to be desired. I think there's always going to be more and more work getting done around these platforms and keeping them secure, keeping people's information safe. In a healthcare setting, we know that's a really important aspect of it. And I think we've seen a lot of very fast progress on all the underlying technology that we see these platforms use. But I think that will take a little while to trickle down and to sort of make it into the market. But that is exciting. So Amazon has announced their telehealth expansion in 2021. We know about Walgreens. We already spoke about them a little bit, and Walmart with their MeMD partnership. So we do know everyone's sort of thinking about this, and it is happening. These are some of the specific things that Amazon has sort of announced that they're doing, implementing their app, which has the 24-hour virtual care for nurses and practitioners. That's sort of what we're talking about. You can just go on there and be talking to the nurse or doctor quite quickly. The sort of care teams around the app is. I think it's going to be really interesting to see how they do sort of try and address some of the challenges we've been talking about, where there's a hybrid of face-to-face care required, where you do want to see your primary physician occasionally in person, even if most of the time you can use telehealth. But I think we'll find out more and more about this over the next year or so as Amazon roll it out further. And we know they do these things quite quickly. I don't know, like it felt to me like they announced the Amazon Go stores where you can walk in there without paying the cashier or anything. Feels like they only just announced those, and then one of them popped up next to me like a week later. So I think they do it fairly quickly. I think that's something we're not so used to outside of technology industries. We kind of think that everything will take a few years before it really hits us. But if there's anything I think we've seen from Amazon's track record, this is going to be a big deal quite quickly. And we know it's a huge market. We know that they've identified that. And if Amazon are investing in it, they won't be doing it by halves, I don't think.
I wonder.
Yeah.
I wonder if Amazon, honestly, I don't know if they're going to have stamina on it. It's significant. I mean, Carl, you're in a healthcare providing situation. It's not trivial. And Amazon might not understand what a big deal it is to provide healthcare. I'm like, okay, guys, maybe. They could certainly do pharmacy like crazy. I know they could distribute medicine, but doing healthcare is a lot. And so maybe they will pursue it, and maybe they'll kind of, You know,
I,
they're like, yeah.
I think the interesting thing is, Murphy, I had conversations with retailers, very, very similar approach.
Yeah.
Like, oh, they don't understand
Yeah.
like our custom like we know that some retailers it's a risk for, like we know with books, like, oh yeah, books, that was the sort of thing that was easy to do on Amazon, and like the Amazon are really great at books, but they're not going to come after us in like streetwear or whatever it is. And I think uh, Amazon have really proved that they do work a lot of this stuff out. So I think, and
Okay, so you're thinking they can do it. Okay, maybe.
I think they can do it, and
There's something about, you know, when somebody is bleeding and dying in front of you, that's a lot of tension.
yeah, I think they're not going to do everything, but I think they'll find the profitable parts, and I think they'll extract those, and maybe the rest of the industry is left sort of caring for the people that need it more urgently, or that I'd be concerned about margin erosion and things like that. Like, how does that sort of work? How does Amazon, with all the smarts they have and all the technology they have, are sort of picking the eyes out of the healthcare market of the things that probably fund a lot of other stuff at the moment, and the things that the like smaller or more sort of traditional healthcare providers are left with are just sort of the hard, expensive parts that might be hard to make money out of. I think that's definitely a risk. I think that's something I would be concerned about.
Well, here's the thing. I mean, the healthcare is like, okay, you can do like some sort of low level healthcare, but then if you have to escalate to greater care, then Amazon or whatever disruptor new provider is going to have to figure out how to plug into that next level. Like, okay, at what point do we have chemotherapy? At what point do we have all these long-term care that are quite a margin eroder?
Yes, yeah, I think it's certainly interesting.
It's good that they're trying it, because we have an aging population. We're going to need to have all hands on deck to figure out how to best deliver care and services to our American people. Because I plan to get really old. I don't know about you.
See, I grow my hair. It's happening every day.
Okay.
No. Yeah. So I think this last point is the other point I'm trying to get at. I think it's similar to what you were just saying there, Murphy, is once Amazon does come into it, it raises everyone's expectations. Like, no one used to expect to be able to get something delivered the next day. Like, we were used to waiting a week to get things. We were used to having to go to the store. Amazon raises the bar on that. And maybe this is going to happen with sort of things like appointments. If Amazon can offer you your appointment within a few minutes of getting it, of wanting it, maybe that becomes a new customer expectation, a new patient expectation of everyone. If patients can access their records at any time through like a portal or something, because Amazon's really good at that part of it, maybe that becomes like the market standard for that. So I think that's where we'll start seeing those pressures applied as well. We already spoke about books. I'm wary of everyone's time. We actually have 4 minutes left. So we'll work through this quickly. We already spoke about books, so I think we're good there. Yeah, so what we wanted to get on, and what we were meant to talk a lot more about, but maybe in another time, was what you can actually do about this. We just spent 25 minutes talking about all the risks of it, and hopefully we're all more aware. But how can we, and what we see this a lot, like Amazon is pushing into different industries, but other vendors, other providers, other software providers are working with everyone else to try and bring similar technology to help these the traditional companies compete with Amazon or Walmart or whoever it is by bringing the same tech to them and bringing it to a lot of people. So I saw in the O'Hare Airport, like an independent bookshop has set up an Amazon like Go store, not using Amazon's technology, but they've bought technology that's very similar, and people are out there making it. Amazon doesn't have a monopoly on this stuff. Other people can make similar technology. And I think that's what we're really going to see is a lot of healthcare providers are going to need to adopt more of that, and more cloud systems, more things to help.
I think that the EMR or EHR that Carl talked about, he wasn't so happy with that. That's going to be critical too. And it may be once people have adopted one, electronic health record. It might be that it's easy to upgrade to another. Like, oh, we've done it once and that was incredibly painful, but then moving to the next health record care could be not so hard, and more features such that you upgrade your technology, get modernized faster.
Yeah, 100%. These bloody millennials, Carl, wanting telehealth everywhere. Yeah, I think that's the other trend we didn't even mention here, is that it probably is a generational thing, how comfortable people are taking telehealth, and it doesn't seem likely that as more and more, I'm assuming personally we're going to have a huge baby boom out of COVID. So all the kids born today, and they might only expect telehealth. So as a longer term trend, I think this could be a.
So there's going to be a reduction in need for those embarrassing like hospital gowns.
Yes.
Got a couple of slides left, so we are cautious of everyone's time, so we'll try and finish up on the minute. But what are some things we can do in traditional care organisations? We want to focus on these differentiators. Now, we've already spoken about how people want face-to-face. That's going to be the gold standard. People want to see the same doctor or the same carer every time. They want them to know their community. They want them to sort of be a part of it. So making sure that that's actually the case, and we're not having, they don't see a different nurse every time because it's too hard to schedule them, or there's not such high turnover in your organization that you can't offer this personalization. I think that's really that's going to become the main competitive advantage that we can offer in traditional care organizations. So making sure that actually is possible to do, I think, is a big part of it. We know most people still at the moment do prefer to see people in person. So if we can make that convenient, we can still sort of maintain that. I think you mentioned, we've sort of spoken about the overburdening providers and how we make it convenient for them. I think those type of problems will get solved, but just being aware that if you're going to start your own telehealth services, how that workload gets balanced with the in-person stuff, and how we make this work for everyone. And then managing the health risks around that, which I don't really want to speak to myself. I'm not a healthcare professional, but it's just something we wanted to point out here, that there probably is always risks that people are, I'm sure, are aware of and know about. But yeah, that's really the main things we came up with, and feel free to throw other suggestions in. I think we've had some really good conversation in the chat, and we are interested to hear how people are thinking about this and what they are doing to solve some of these problems. Cool.
Okay, great. But yeah, we just want to make sure we ended on time. So we want to thank everyone for attending. We got a lot of really great participation and questions from the audience. So we definitely appreciate everyone's participation. We're always coming out with new and relevant content. I actually think we have 2 more webinars coming up before the end of the month. So just keep an eye out for emails. And once again, thank you, everyone. Thank you to our speakers, and everyone have a great day.